Hello, my name is Lexi. I'm going to be your nurse practitioner today. I'm going to be doing a head-to-toe assessment on you, if that's okay.
Alright.
Let me just clean my hands here. Alright, first I'm going to take a look at your hands. Can you hold them out for me? And flip them over. Good. No nodules noted. Can you move them all the way? Perfect. And I'm looking at your nails here. No clubbing noted. Just checking your capillary refill to see how your vessels are working. Perfect. Capillary refill is less than 3 seconds on all nails. Squeeze. Perfect. You can let go. And then I'm going to have you lift this up like that for me, and then down. And then again, so you can do the same thing. And down. Perfect. And then with your wrists, can you kind of down and up, and the same thing. Up. Perfect. And then lift your arms up, and down, and then out, and down. And then do all that against me. Good. 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 Muscle strength is 4 throughout. Range of motion is appropriate. I'm going to check your reflexes now. First, I'm going to check your biceps reflex. Can you kind of, yep, and then relax it for me. Good. Anything over here? Relax it for me. And then triceps reflex. Good. Think a little one more. Thank you. Good. And then just kind of lay your hand. Yep. Check your brachioradialis. Good. Good. Reflexes are all appropriate. No hyperreflexia noted. Alright, I'm just going to feel your arms now. Any pain?
No.
Good. No nodules noted. Alright, I'm going to have you close your eyes for me and then hold this palm out. I'm going to place an object in it, and I want you to tell me what the object is. You can move it around as you need.
It's a house key.
Perfect. And then the same thing in your other hand. It's going to be a different object.
Paperclip.
Yep. Alright, and then with this hand still stay here, I'm going to draw a letter, and you tell me what letter it is.
T.
Okay, and then this one.
C.
Perfect. And then I'm going to touch you with two times. Keep your eyes closed. One is sharp and one is dull. Tell me if you can tell the difference. Sharp, dull.
I can tell.
Okay, I'm going to do it up and down your arms, and you just tell me if it's sharp or dull, okay?
Okay. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Good, and I'm going to do it on your face. Same thing, okay?
Okay. Sharp. Sharp. Dull. Dull.
Perfect. And then can I have you keep your eyes closed, just kind of hold your hands up like this. Just hold them there, and then tell me, is your finger moving down or up?
Down. Up.
Perfect. You can open your eyes. I'm just going to feel your pulses here. Good. Radial pulses are 2+ bilaterally. Alright, I'm going to move on to your eyes now. So, first I'm just going to shine a light in your eyes. You can look like straight over my shoulder. See if it reflects. Good. Corneal reflex is appropriate. I'm going to check your pupils now. Can you just look straight ahead again? I'm going to shine the light again. Good. Pupils are equal and reactive to light. Now keep your head still and follow this with just your eyes, okay? And then keep it focused as I move it in. Good. Eyes tracked symmetrically. No nystagmus noted. Accommodation is appropriate. So now I'm going to have you look at that picture up on the wall. I'm going to cover one eye, and then when I move this, I want you to just keep looking at the picture right there. Perfect. And then you can kind of reset your eyes, and then same thing. Good. Eyes stayed focused on the picture. Alright, now I'm going to have you stare straight at me. I'm going to move my finger and tell me when I'm wiggling my finger, okay?
Okay. Now. 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 Now.
Okay. So now I'm going to have you, kind of turn towards me a little. I have you take your pointer finger on this hand and touch my finger, and then go to your nose, and then just back and forth like that. Perfect. And then same thing with that. Perfect. Alright, you can turn back around front. Get this ready. Alright, so I'm going to look at the outside of your eyes. Can you close them for me? Any pain when I touch?
No.
Alright, open them for me. Look at the inside. No exudate noted. Sclera is white. Alright. So now I'm going to take a look in your eyes, okay? So I'm going to kind of bend towards you. You can just look directly over my shoulder, okay?
Okay.
Good. Red reflex noted. Retina visualized. Vessels are appropriate. Optic disc is visualized. Good. Give you a little break there. And then same thing, just look over my shoulder. You ready?
Okay.
Red reflex noted. Retina visualized. Optic disc is visualized, and the vascularization is all appropriate. Alright, and then one last thing for your vision. This little chart, you can start at the lower lines, hold it about 14 inches from your face, and then read those last three lines for me.
LEFODPCT FDFLTCKD PELOLCDTF.
Perfect. Alright. So now I'm going to take a peek at your ears. I'm just going to look first. I'm looking for moles, nodules. I don't see any on that side. None on this side. Does it hurt at all when I touch?
No.
Okay. So I'm going to whisper something in your ear, and I want you to tell me what I'm whispering, okay?
9.
Okay. Same thing over here.
7.
Perfect. Alright, so now I'm going to take a look inside your ears. Okay. And if it hurts you, let me know, okay?
Okay.
TM visualized. Pearly gray with no bulging. Cone of lights at 7. There's a little wet cerumen present. Same thing on this side. Just gonna pull your ear back out and up. Again, TM visualized. No bulging noted. Cone light at 5. Alright. And then I'm going to, this makes like a vibrating noise. I'm going to put it like in the middle of your head and tell me if it sounds louder on one ear versus the other, okay?
Sounds the same.
Okay. Now I'm going to make the same sound behind your ear and then tell me when it stops. When you tell me it stops, I'm going to move it in front of your ear and tell me again, okay?
Okay. It stopped. It stopped.
And then same thing on this side.
Stop. Stop.
Good. No evidence of conductive or sensory neural hearing loss. Alright, I'm going to take a peek at your nose. Maybe. Alright. Look at the outside of it first. Any pain when I touch?
No.
I'm going to have you just tilt your head up so I can take a peek in it. Good. Nares are both pat and no excess moisture. Perfect. Alright, and then close your eyes for me. Can I have you tell me what this smells like?
Mint.
Good, it is mint gum. Keep them closed. What does this smell like?
Coffee.
Sorry, you can open your eyes for me. Alright, I'm just going to take a look at your face now. Any pain when I touch here where your sinuses are?
No.
Alright, I'm going to tap them and then tell me if there's any pain.
No.
Perfect. Can I have you open your mouth really wide? No clicking noted. Any pain with that?
No.
Perfect. And then I'm just going to feel your temporal arteries here. Good. Arteries are 2+ bilaterally. And then just tilt your head down for me and then take a peek at your scalp. Hair is clean, no dandruff noted. No moles or nodules noted. Any pain when I'm touching your head?
No.
Okay. Alright, you can look up. I'm just gonna feel here. Any pain in your mouth when I touch here?
No.
Okay. Can you smile for me? Stick your tongue out at me, wiggle left and right. Close your eyes really tight. Open them really wide. Puff your cheeks out. But try to keep them puffed when I press, okay? Perfect. And then can you stick your tongue against the right side of your mouth and then resist me? Perfect. Good. Tongue strength is equal bilaterally. So I'm going to take a look at your mouth. First, I'm just going to have you open really wide. And then stick your tongue out. Good. Tongue symmetric. And then I'm going to kind of hold it down so I can look at your tonsils a little better. Good. No edema or erythema noted in throat. Tonsils are appropriate size. Lift your tongue for me. Frenulum appropriate. Smile. Teeth all look good. No dental caries noted. Any pain on the side of your mouth?
No.
Okay. Alright, so now I'm just going to take a look at your neck. Okay, no nodules noted. Any pain when I touch?
No.
Alright, I'm going to feel your nose now, or your glands. So preauricular. Thank you. Postauricular. Submandibular. Submental. Clavicular. Superficial. And then posterior. Cervical. And then deep cervical. Occipital. And then clavicular. Lift your arms for me. I'm just going to feel your axillary. Good. No lymph node enlargement noted. I'm going to just feel your trachea now. No deviation of trachea. And then your thyroid. Can you swallow for me? Good. I'm going to feel your carotid pulse here. No thrills noted. And I'm going to listen to that as well. I'm gonna have you hold your breath while I do this, and then I'll tell you to breathe again. Good. You can breathe. No bruise noted. And then hold your breath for me again. Good. You can breathe normal. No bruise noted again on that side. And then I'm gonna have you look left and right for me, and then up and down. I'm gonna do that against me. Good. And then shrug your shoulders. Good. Muscle strength is all. Excuse me. All right, and then I am gonna have you turn, and then one more thing, open your mouth and say ah. Good. You feel is appropriate. All right, so we can turn around. Excuse me. Face the wall. And then I'm just gonna take a look at first. You can breathe normal. Good. No use of accessory muscles. AP diameter is appropriate. Can I have you take a deep breath for me? One more. Perfect. Expansion is symmetric. So now I'm going to have you say 99 for me.
99.
And then again.
99. 99. 99.
Good. Check diaphragm, this is appropriate. Now I'm just going to kind of tap your back. You can breathe normal, okay? And lungs are resonant. I'm going to take a listen now. Every time I move my stethoscope, I want you to say E, okay?
Okay.
Go ahead.
E, 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 E.
Good. Ease off any negative. Now take some deep breaths for me. Good. And then just kind of lift your arms for me, cross them in front of you, and then turn this way, your whole body. And then a couple more deep breaths. Good. And then turn that around. Perfect. And now I'm just going to kind of hit your back, and I want you to tell me if it hurts at all, okay?
Alright. No. No.
Good. No CVA tenderness. Alright, you can turn and face front. Again, I'm just going to watch you breathe for a second and breathe normal. No use of accessory muscles. I'm just going to feel. No lumps or nodules noted. Take some deep breaths. Perfect. Lungs are clear and equal anteriorly and posteriorly. Alright, so now we can go back to the couch. So I'm just going to take a look first. No pulsations or heaves noted. Feel, just feel. Perfect. Now, the PMI, feel for that. Good. With the fifth intercostal space, mid-clavicular line. Them as regular. Take a listen to that. Time it. Heart rate 62. So now I'm going to listen with my diaphragm to your heart. So first at the aortic site. Pulmonic site. Erb's point. Tricuspid area. And mitral area. Good. S1 and S2 heard, no murmurs or extra heart sounds, but I'm going to listen now with the bell of my stethoscope. Again at the aortic site. Pulmonic. Erb's point. Tricuspid. And mitral. Good. Again, no murmurs or extra heart sounds were noted there. Alright, I'm going to just take a peek at your stomach. The abdomen is flat. No extra pulsations are noted. Alright, I'm going to take a listen to your bowel sounds first. Good. Bowel sounds are normal and active in all 4 quadrants. And I'm going to listen to your abdominal arteries here. So first your aorta. Renal on both sides. Iliac. No thrills noted. I'm going to do this scratch test to see where your liver is. Starts about here. So no liver enlargement. Alright, I'm going to percuss your tummy now. Good. I'm going to see if I can percuss your spleen. Not really able to percuss your spleen. So now I'm going to lightly palpate your stomach. You tell me if it hurts, okay?
Okay.
Any pain?
No.
Good. Now before I do a little deeper, can you just kind of lift your head, do a sit up? No pain there?
No.
Okay. Now I'm going to go deeper. Good. No masses are noted. And then I'm going to feel for your liver. No enlargement. And then see if I can feel your spleen. Not really able to feel the spleen. Alright, so I'm going to feel your femoral arteries here. Good, arteries are 2+ bilaterally, and then I'm just going to feel if you have any nodes enlarged. Any tenderness here?
No.
Okay. Alright, and then I'm going to take a peek at your legs. Hair on the legs looks evenly dispersed. No nodules noted. Just going to feel any pain.
No.
No edema. No pretibial edema. Just going to feel your pulses here. You can just relax. Dorsalis pedis 2+, and then tibial. 2+ also. I'm going to check the cap refill on your toes like I did on your fingers, okay? Good. All less than 3 seconds. I'm going to have you take this heel, and can you run it down your shin? Good. And then this one. Perfect. Alright, so we can come back Now to the chair. Grab my equipment again. And then the same thing we did on the arms, we're going to do on your legs, okay? So, close your eyes. We'll go over it sharp again and then soft, okay?
Okay. Sharp. Sharp. Dull. Sharp. Sharp. Dull.
Perfect. And then keep your eyes closed for me. Is your toe going up or down?
Up.
Correct?
Down.
Perfect. Alright, now I'm just going to check your reflexes while we're here. Have you dangle again. I'm going to check your Achilles first. Good. And then on this side. Alright. And then I'm going to check Babinski reflex. Perfect. Perfect. And then patellar. And then can I have you lift your knees up and down and then against me? Down. Perfect. And then this one. And then against me. Perfect. Alright. Muscle strength is 4 and range of motion looks great in the lower extremities. Reflexes were all appropriate with no hyperreflexia noted. Alright, I'm going to have you stand now. And then I'm just going to have you come towards me and then walk straight across the room. Perfect. No gait disturbances noted. And then come back towards me. Good. And then you can face that way and close your eyes and just try to keep balanced. Romberg side negative. Good. And then you can open your eyes. Face that wall. I'm just going to look and make sure shoulders are symmetric here, which they are. Hips are at the same height as well. And then can you bend forward for me? No curvature, the spine noted. Alright, you can stand up, you can have a seat. I think that's all. Do you have any questions for me?
I do not.
Okay, perfect.